My name is Tina Ismail. I currently work at University Medical Centre as a specialist nurse there. Qualified back in 2001, trained at Christchurch University College. I went into secondary care and was there in the hospital for 10 years initially on an acute medical and oncology ward. I overlapped into primary care towards the end of that. Started out with one session a week, which was actually an anticoagulant therapy monitoring clinic. I then developed more skills and went into diabetes management. I did the diabetes management diploma in primary care. Took on diabetes clinics along with other treatment room skills such as cervical screening, immunisations, ear irrigation. After that, I carried on to do some pit stop diabetes, which is obviously oral medication program. And then following that, went on to do the advanced injectable therapies program. I completed mentorship course at Christchurch, and then 2 years ago I moved to a specialist role which was created in the practice I'm at now, which I'm doing a frailty, cancer care and diabetic lead. Primary care seemed to be more family orientated. I had 3 young children at the time, so it seemed to be more kind of family orientated to fit kind of shift work and things like that around school. And also I found that there was more avenues of training, so obviously having different skills, it was really quite nice to be able to say, well, I quite enjoy diabetes, or you could do respiratory skills. In primary care you kind of work more autonomously. You can work in a smaller team but kind of more valued, and I think you get to know patients a bit closer, so it's more continuity. So with a specialist role that I do a combination of frailty, cancer care and diabetes. My frailty, I actually invite patients into the practice and I tend to do a full annual check on them. So that could include also any of their chronic health problems. If they've got diabetes or anything like that, I can actually do their checks, their bloods, their observations, and also I go through and do a care plan with them, discuss resuscitation. I discuss advanced care planning, what they would like in the future if they were to become really sick. Would they want to be cared for at home, or would they want to be cared for in a hospice or in a care home? So whether they've got wills in place, I kind of go into depth into their care really, which is really quite nice. And also find out if they need any extra support, whether they need help at home. Do referrals. I involve social care teams. I actually attend a meeting on a Wednesday that involves physios, OTs, a huge amount of multidisciplinary team really, and we all liaise together. The cancer care role is a new one I also took on. I obviously see patients, so obviously if we get a patient that's diagnosed with cancer, I contact them within 3 months of their diagnosis and introduce myself. I provide them with resources to be able to have contact information from Macmillan and other teams in the community that support people with cancer. Alongside this, I follow them up through their journey. So I talk to them regularly. If patients need more calls, I will call them regularly or invite them in face to face. And then I will also complete their 12-month review for their cancer care as well. I also link in with other teams such as the hospice, and I've also followed patients through end of life actually, which is really precious. So I've actually been involved in some patients that have actually passed away at home, and also patients that have gone to the hospice. I tend to pop in and just show my face for support for the family and for the patient towards end of life, and follow up the family afterwards. It takes the pressure off of the GPs, because when I see a patient, I probably have maybe an hour to do a care plan, and I complete that care plan, and I also complete anything else outstanding, including referrals, and I also can liaise with any of the teams in the community. So I tend to do the whole package rather than the GP have to see somebody in 10 minutes and try and complete all paperwork, referrals. The patients tend to have a contact which they all really enjoy, knowing that they're going to come and see Tina, or they can call and ask for an appointment with me. Even the families have got to know me quite well now, so it's a link for the family and for the patient really. I feel really supported, to be honest. I've always got the GPs around to ask questions, or obviously if there's any kind of queries or anything I'm worried about. I also have a GP that also puts aside some time on a Friday afternoon. So if there's any issues or any worries, or a bit of one-to-one really for us too. So if there's anything that is affecting me or I'm not coping with something, then she's always there, which is really nice. Well, I'm currently doing a clinical consultation module at the moment at Christchurch University, which will then link me into doing my non-medical prescribing, which will enhance what I do now really and complement my job. It's a level 7 course. It's a bit more challenging, but to get through this initial one, I will be following the next course in January.